I walked out of the hospital and realized, well, now what?
What's my quality of life going to be?
The burden of medical expenses is just huge.
I thought that becoming a mom wasn't going to be a possibility anymore.
How much longer am I to deal with this? Am I going to have it come back or not?
This is something that I'm really going to have to deal with for the rest of my life.
A decade or two ago, physicians and others in the healthcare field felt like they had succeeded when they could say to a cancer survivor, congratulations, you finished your treatment, you're going to survive. And yet we knew that wasn't enough.
Being a post-treatment survivor really has a lot of implications for everything that goes on in your life. You may not be able to go back to the same level of work that you were doing before. You may have issues with your insurance, and you have to learn to cope with that and think about what that means for how you're going to live the rest of your life.
LIVESTRONG decided to focus on post-treatment survivorship, and what we found was many institutions were putting programs in place to address the needs of survivors, calling it a survivorship program, but the components of it were vastly different. And so we convened over 150 researchers, clinicians, survivors to come together and really talk about what can be done and what should be done at a minimum.
As a result of that meeting, we developed a 3-tiered list that identified 20 elements of survivorship care. Tier 1 consensus elements are those things which people must do, and this includes things like survivorship care plans. The second tier are the high need elements, and that includes things like providing nutrition services. Tier 3 elements, or the strive elements, are those things which institutions should strive to do, for example, self-advocacy skills training.
Cancer is so many different types of diseases, and so to provide survivorship care for the general population is often hard for healthcare professionals. So the essential elements of survivorship care are critical so that everybody has the same platform and everybody understands the expectations of what care they need long term.
We're at an exciting time where people are surviving cancer, and that's a huge, exciting shift. But we need to think about the post-treatment experience and what that looks like and how we can best serve those patients for the rest of their lives.
Everything is new after cancer, everything.
I feel like I can start all over again, and I can have the same hopes and dreams that I had then.
I have a greater appreciation for myself and my life.
I feel like I'm even able to be there for my son more than 100%.
One learns that they're not alone.
When you almost lose something and then you have an opportunity to have it back, it's very special.